There are unprecedented changes coming to 6 states with regards to Medicare. Now, these 6 states are really just the tests. So, is your state affected? What's going on? And how will this affect you? Well, let's talk about it in today's video. These big changes are coming to Original Medicare starting in 2026. CMS is launching not 1, but 2 pilot programs. One of the main selling points of Original Medicare, which is Part A and Part B, is that it allows its beneficiaries to see any provider or utilize any hospital who accepts Original Medicare, and almost all do. There are no networks, and this sharply contrasts with Medicare Advantage. This is certainly one of the downsides. Additionally, one of the main benefits of Original Medicare is that there is no pre-authorization, and this is a huge problem for Medicare Advantage. But healthcare spending is soaring, and CMS is under pressure to cut wasteful or unnecessary services, estimated to cost Medicare billions annually. First, let's discuss the proposed WISeR model, Wasteful and Inappropriate Service Reduction. This will launch January 1st in 2026 in 6 states, including Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington. Is your state affected? Do you have concerns? Let us know in the comments below. Now, as I already mentioned, formally, Original Medicare really didn't require pre-authorization, except really for durable medical equipment. With WISeR, this will change. WISeR will expand that to services like skin and tissue substitutes, electrical nerve stimulator implants, and knee arthroscopy for osteoarthritis. It also introduces AI-supported review. AI will screen for eligibility, but don't worry, a physician will still make the final call. There will be no robo-denials. Contracts will go to private firms. They'll be paid based on how much they reduce unnecessary services and Medicare spending. Now, obviously, with any change, there comes concerns. Critics argue that this will erode some of the basic structures of Original Medicare, which limits the bureaucracy involved. There are reports that show that AI can generate denials at rates up to 16 times higher than normal. There are also worries that denial-linked incentives could warp provider behavior and delay necessary care. Policy experts warn that it could prioritize costs over patient care and stress an already stressed healthcare workforce. Now let's talk about the TEAM model, Transforming Episode Accountability Model. This is also set to roll out January 1st, 2026, but it's set to roll out nationwide. Its plan is to target surgical episodes, however, not pre-authorization. Hospitals in certain regions will participate and coordinate a full episode from surgery through 30 days post-discharge. Covered procedures include joint replacements, hip fracture repairs, spinal fusion, coronary artery bypass graft, and major bowel surgery. CMS will set a target price for the episode. If the care costs less, hospitals may earn rewards. If it costs more, they might owe CMS, but this is all subject to quality performance. Now, this is supposed to be implemented slowly with a glide path. There is no downside risk in Track 1 for participating hospitals. However, that risk reward would be introduced slowly on Track 2 or Track 3, especially for safety net and rural hospitals. Now, the goal here is to improve patients' post-surgical experience by promoting primary care referrals, reducing readmissions, and better coordination. Although Medicare does already have in place penalizations for hospitals that have a high readmittance rate within a certain time frame. And critics argue that clinics might skimp to meet targets, which would pose a risk in rural areas. Both of these programs reflect CMS's shift towards value-based patient care. However, they really are very different. So WISeR will only affect 6 states as of right now, and it's targeting pre-authorization, as opposed to TEAM, which is directed nationwide and will be really targeted towards surgical episodes. A brief pause here. Medicare is confusing and, quite frankly, getting more confusing by the day. So if you have questions, you can reach us in the comments below or at the number on the screen. We're licensed health insurance brokers. We're licensed nationwide, and there's absolutely no charge for our services. So please do feel free to reach out with any and all questions, comments, concerns. Of course, we do release these videos on a weekly basis, and with these rapid changes to Medicare, we highly recommend that you subscribe to stay up to date. And please like this video so we can get this information out there. All right, let's get back to it. These changes truly are unprecedented. unprecedented. If they get these changes right, then that could mean smarter, safer usages of Medicare. However, if they don't go smoothly, then this could mean delays or denials for seniors who rely on Medicare for their health coverage. So what does this mean for the future, and what should you keep your eye on? So with WISeR, this is currently just affecting 6 states, but will that expand in the years to come? Also, will CMS release timely data on delays, denials, and outcomes? Because that is the biggest concern with WISeR. If we're talking about pre-authorization, yes, they do supposedly have that safeguard in place that there will be no robo-denials, but if AI is 16 times more likely to deny a procedure, how will this actually come to fruition when it's in place? And TEAM will already be adopted nationwide. Now, will this lead to better patient and more cohesive patient care, or will hospitals be rushed to try to meet their target? Time will tell. Congress, states, or the courts might push back if beneficiaries suffer, but first, these programs would have to show that they are failing Medicare beneficiaries. And believe it or not, these are not the only huge changes coming to Medicare in 2026. We've released videos on that, and I will put that video over here if you'd like to learn more. Of course, if you'd like to learn more about Medicare in general, make sure to check out our All About Medicare playlist. Now, if you have questions or concerns, you can reach us in the comments below or at the number on the screen. We are licensed health insurance brokers. We're licensed nationwide, and there's absolutely no charge for our services. And before you go, don't forget to like and subscribe. We'll see you next time.